When I went to medical school, I was adamant that I would be a pediatrician. It was just emotionally draining, and I figured, you know what, I need to go back to the drawing board and figure out what it is that I'm going to do. I wanted a specialty where there was limited patient interaction. Hi everyone, welcome to Making Healthy Choices with Dr. L. If you're new here, hi, I'm Dr. L. If you're a returning subscriber, welcome back. If you are interested in hearing my story as to how it is that I picked pathology as a specialty, stick around and watch this video till the end. When I went to medical school, I was adamant that I would be a pediatrician. And a pediatrician is a doctor that takes care of children. I bet it has to do with the fact that my mentor is a pediatrician. And so, yeah, I wanted to be like him. He seemed really cool and he was doing cool things and he was doing hospital admin and all of that cool stuff. So I went through medical school, got to clinicals, did all the required rotations, of which one is pediatrics. So it's one of the core rotations, and I did my core rotation and I liked it. I felt like, that core rotation was really nice. Then I moved to a different hospital and I did an elective there. And that rotation was challenging in the sense that obviously it was a different environment from my core rotation. It was in a bigger city. The population was more diverse in London, which is good for training. Encountered some difficult, you could say, cases that made me sad, or patients that made me sad. And yeah, I'd go home after a day on the ward feeling low and not wanting to go back the next day, but having to because I signed up for this medical school thing and I'm trying to graduate. When I moved to the third and last hospital, I did another elective, but this time I spent some time in the neonatal ICU. And there's one case in particular that after encountering that patient, I decided for a fact that pediatrics is not for me. I cannot handle seeing sick children. It was just emotionally draining. And I figured, you know what, I need to go back to the drawing board and figure out what it is that I'm going to do. And mind you, I was doing this second elective towards the end of my training. At this point, I had taken USMLE Step 1, I had taken USMLE Step 2, CK, and I had not taken Step 2 CS, which at the time was the third exam that was required for one to apply for ECFMG certification. So I figured at end of medical school, let me just go back to Botswana and try and figure things out when I get there. Maybe I'll discover something that I like, or a specialty that I like in medicine. I think one of my favorite rotations when I was an intern was pediatrics, but until I did emergency medicine and I think emergency medicine was the last rotation that I did as an intern, and I stayed on as a medical officer once I graduated from internship and became a medical officer. So I carried on in the ED for about 5 months after finishing my internship, and I loved it. I loved working in the ED, mainly I think because of the team. I did not see myself doing it for the rest of my life because shift work is not easy. So yeah, in as much as I loved emergency medicine, I could not see myself doing it for the rest of my life. So that was a no-go in terms of specialty. Peds, I loved it, loved the rotation. However, I didn't see myself doing it again for the same reasons that I mentioned earlier. Then I got transferred to a district hospital. The hospital provided accommodation for 2 weeks, and during those 2 weeks, I was supposed to find a house. Unfortunately, I was not able to find a house, and I took time off after those 2 weeks. And yeah, while I was away, I got a job in the private sector. I got a teaching job. I resigned from the medical officer position, and I started teaching in a health science college in the School of Public Health. And yeah, that's what I did for 3 years. While I was teaching, I realized how much it is that I missed medicine. And I felt like I loved teaching, and I felt like that something that would allow me to do both medicine and teach would be the sweet spot for me. So I did some locums while I was a lecturer. I realized that in as much as I love teaching, there's a ceiling as to how much it is that I could grow in academia unless I do a PhD or I go back to medicine and teach in medicine. But for me to teach in medicine, I would need to be a specialist or have gone for residency training. So that's where residency training sort of came up. By the end of 2016, I had applied to take the last required exam for ACFMG certification. And in January of 2017, I took the exam, got my ACFMG certification, and I told myself we are going to apply for residency. And when it came to applying, I had to think back to medical school, to my time when I was an intern, to figure out what it is that I really wanted to do. And there were several factors that sort of influenced my decision to do pathology. One was that I love basic medical sciences, and I felt like I would like to do any specialty that would allow me to at least be in touch with basic medical sciences. That's one. Secondly, I wanted a specialty where there was limited patient interaction. So my options were pathology or radiology. Of those two, I felt I gravitated more towards pathology for several reasons. I love pathology in medical school, but it's not even like the pathology in medical school and the pathology in the clinical setting is different, to say the least. And my first interaction with a pathologist, other than in medical school, was at a multidisciplinary meeting where pathologists, radiologists, surgeons, and oncologists would meet to discuss patients. Oncologists would basically present the patient and say, this is patient so-and-so who came in with such symptoms, was found to have a mass if they had cancer, which was removed usually by the surgeons. And then the radiologist would go through the imaging findings, and then the pathologist would go through their findings. Another interaction that I had with a pathologist was during my hematology rotation in England. And the hematologists in England deal with or treat lymphomas and leukemias, which are blood cancers. And they would also have multidisciplinary meetings with the oncologists and radiologists and surgeons in some cases. The pathology would then be discussed at these meetings. I thought back to that, and I loved hematology and I loved hematopathology, but I knew that in England, for me to become a hematologist, I would have to do internal medicine. It's something I was not interested in doing. And so since I had already taken USMLEs, my option was do pathology and then to do hematopathology since I love hematology so much. In September 2017, I submitted my applications for residency, and I got a couple of interviews, attended the interviews, and I matched. In March of 2018, I found out that I matched. I ended up in Pittsburgh, Pennsylvania, and that's where I spent 4 years doing pathology residency. I know it sounds like it was that easy, but it was a long journey with a lot of hurdles along the way and a lot of challenges along the way. If you're interested in finding out more, stick around and watch out for a video that will go through some of the challenges that I faced. If you've made it this far, kudos to you. I really, really appreciate it. If you have any questions about applying for residency in the US, or if you have any questions about schools and medical schools and stuff, drop a comment down below. Thanks again for watching, guys. Until next time.